record.
Is that showing the screen, the whole screen?
Yeah, it's showing all of it. I think it's recording. It says stop recording. Okay, round 2. What does that mean? Button. Okay, so this is our second try at explaining what patient-centered care is, part of our 454 class. I'm trying to get rid of this thing. Okay, there you go. All right, so here's Carlos, and he's going to talk about what he wrote about patient-centered care.
All right, so our topic is patient-centered care, and the definition for patient-centered care is providing care that is respectful and responsive to individual patient preferences, needs, and values, and ensuring that patients' values guide all clinical decisions. The main part of having a facility be patient-centered care is having everyone work as a team. You have to have all the staff work together, from like the janitor to the CEO. Everyone has to be involved in patient-centered care. Also, family is a big part, since they provide emotional support for the patient and they provide motivation. Also, friends are a big part, just for support also, and just to make the patient feel better. For planning a patient-centered care plan, it has to be customized to the patient. You have to know basically everything about the patient, like what they like to eat. You got to know how to talk to them, since every patient has a different personality. Also, even the bills have to be customized to make it easy for the patient to understand, so they could fill out bills and paperwork. This makes the patient feel like they're in control, which is good. Environment for a patient-centered care facility has to be welcoming, friendly, and the patient should feel like they're at home.
Okay, so I talked about some of the goals that therapists should have in mind. So some of them are to have the client create physical well-being as well as mental, cognitive, and emotional. So not only do they have these goals to keep in mind, I think it was important, especially with patient-centered care, to have a time for them to broaden their horizons with the different activities that they could do in order to have a well-balanced well-being and go back, have the opportunity to go back to what their lives were before, said disability happened or said accident. So there's always room for improvement, and there's always room for other possibilities. So it's important to have the connection with the client. It's important to keep their motivation up, and that way you have a connection with them. That way they feel more comfortable, and they feel as if they could come to the therapist for help or advice, and you can give them some introduction as to what TR is, or not TR, what well, you can even talk about that and what therapeutic recreation can do for them. So I think it's important to have empathy as well, and like that will create a comfort level for them, and maybe that way it'll be easier for them to participate. The last thing I kind of wanted to talk about was integration, and how my personal idea of combining forces with people that are in TR and occupational therapists. That way they have a notion of brainstorming and having more ideas and creativity, instead of having those two separate completely. I think it'd be a really effective idea to have those two fields connect, and just kind of have this new learning skill and have an open mind to new things. I think it's really cool that Therapeutic Rec does that. It's pretty much the same thing, like assessing and giving them alternatives for a better well-being. And pretty much it. I feel like I really learned a lot with this paper, and I learned that there's alternatives to different um, therapeutic recreation outlets, and I hope to learn more. Say anything?
Oh yeah, I feel like patient-centered care is the best way to give care. I would like, if I was a patient, I would like patient-centered care.
Okay. All right. Let's